Thanks. Good morning. Thanks everyone for joining. Just waiting another minute or so for a few more assembly members to arrive. Thanks. Good morning, everyone. All right, I'm going to go ahead and get this meeting started. The recording is on. Thank you, Travis. So I'm going to go ahead and call this Assembly Committee on Housing and Homelessness to order. If we can please get a roll call.
Sure thing. Miss Allard. Mr. Constant.
Mr. Constant is excused.
Mr. Dunbar.
Here.
Miss Kennedy.
Here.
Miss LaFrance. Mr. Perez-Verdia.
Miss LaFrance is excused.
Mr. Perez-Verdia. Mr. Peterson. Miss Quinn Davidson. Mr. Rivera.
Miss Quinn Davidson is excused, and I am present.
And Mr. Weddleton.
Great. Thank you, Travis. All right, so just a quick comment before we get going. I really want to thank the prior leadership of this committee, Ms. Zalatel, for her leadership and excellence. I will do my best to fill those ginormous shoes that are being left. As folks know, Ms. Zalatel transitioned her work on homelessness from the Assembly to now the Anchorage Coalition to End Homelessness. So she won't be participating in this committee as an Assembly member, but she is here with her hat on as the interim director of the Anchorage Coalition to End Homelessness. So welcome, Ms. Zalatel, in your other role. Any presentation materials we received in advance of today's meeting are up on the committee website. If there are any other materials presented today that we haven't received yet, we'll get those up online ASAP. I did want to add one item to our agenda, an update on the warming tent / policies at the Sullivan. That'll be number 5 on our agenda. So we'll go ahead and, unless anyone has anything else to add on the agenda, we'll go ahead and move on to initial audience participation. So I did not get anyone who signed up for initial audience participation, so we'll still do final audience participation, and I will call for members of the public who would like to have their 3 minutes. So let's go ahead and move on then to the business part of our agenda. We have 5 items, starting with Healthy Spaces update. Who from the Parks Department will be presenting?
Hi, this is Mike Braniff, and I'll be reporting for Parks and Rec for Healthy Spaces. Our director, Josh Durand, is unable to be here today. And I was asked to address 2 questions for the Assembly. One is camp abatement currently underway? And no, it's not. And that's because there's no shelter capacity currently. And so what that means is we're not posting new abatements, nor are we acting upon our 10-day abatements that have come to pass. So without shelter capacity, we don't post new ones, and we don't act upon those where the time has expired. In the meantime, we continue to clean public spaces. We're focusing on areas where litter is accumulating and traditionally been accumulating. We work a lot around the Sullivan Arena and the surrounding neighborhoods, the streets and sidewalks, and public areas, and other well-known areas around town. We've also been cleaning within camps in cooperation with the campers. We'll distribute trash bags and visit regularly and collect the filled trash bags from the campers. For us, this is really a win-win. The camp is cleaner for them, and we won't have to clean it in the spring or as much in the spring when the snow melts. And also really we've been, especially this past week since we got the snow last Thursday, really been communicating a lot with the coalition and some of the outreach providers, Rural Cap in particular, in terms of getting outreach workers connected with the folks that we're seeing really need help and and resources out in the cold right now. And so that's really kind of just a brief synopsis of what we've been doing while we don't have shelter capacity. And the second question I was asked to answer is winter camp reporting the same in the winter as it is in the summer? And the answer is yes, it is. And so with that, if anybody has any questions I could help answer, I'd be happy to.
Great, thank you for that report. I'm gonna look in the queue, see if there are any questions. So I don't see anything in the queue. I do have one. So when was the last time that a camp was posted?
The last time that a camp was posted was Wednesday, November 3rd.
Got it. And then I'm not sure how the back end works here. Is there any differentiation between who does the posting? Is it Parks and Rec that does the posting? Is it APD that does the posting? Could you clarify that, please?
Sure. Well, APD is a needed ingredient in order to perform a complete posting. Really, we work on them together with us doing a lot of the legwork of just hanging the signs on trees. But APD is needed, and yeah, we do it together.
Okay, great. So I'll just pause here for a second if there are any other questions for the Healthy Spaces update. Okay, great. Well, thank you so much for that report.
You're welcome. Thank you.
All right, so next we'll go ahead and move on to the next item on our agenda, the shelter outflow and housing surge update. And I believe we do have a PowerPoint slide for this portion of our agenda. So the floor is yours, Coalition. Go ahead.
Hello, my name is Taria Ware, and I will share my screen. So I am reporting today for the Coalition. I am their Systems Improvement Administrator. Thank you for having me and allowing me to report on this amazing work. The housing surge started in about August to help decompress the non-congregate and congregate shelters addressing single adult homelessness. And again, our definition of single adult homelessness are those individuals over the age of 25 with no children in their physical custody. With our partners with ARPA and COVID CARES Act funds, we are able to take this initiative and hopefully decompress the systems as we're continuing to do so. This slide is just a reminder of our scope of work that we have already agreed to. This slide was provided from Mass Care at the beginning of the project of the projected outflow from Mass Care and their brother Francis are now with 99+1 shelters. So if this slide is different or there are changes, we definitely do need to hear from Mass Care. The slide was also taking into account once the contracts were finalized and the staff were hired, this was the outcome they were projecting. Our monthly reporting for October, and we have included the numbers also from July all the way to October, so you can see this previous month's, in case you weren't able to be here for those meetings. As we are getting into more reporting, you might see that July will drop off soon, but we will have as much data here so you can look back as many times as you would like to. The number of total adults over the age of 25 experiencing homelessness in need of housing and supports for the month of October were 2,065 individuals. This number is not who is in the shelter, but it's a number of all of those that have interacted at some point in our system, any touch point of that has stated that they are experiencing homelessness. The total number of adults over the age of 25 served in the Housing Surge Program were 308 unique individuals. And these are services such as case management, medical, referrals to housing, employment, and etc. And then you'll notice an increase in those that were housed this month to the total number of 22 for the month of October. Again, this could be because of the fact that staff was hired in our partner organizations. Contracts were finalized, so we are seeing more people dedicated to doing this work. And if you are looking overall from the beginning, this would be a total of 58 adults that have been housed since the month of July. Surprisingly enough, the more staff you have, the faster things get done, apparently. So our average length of stay or our length of time from the start of the housing surge to the beginning in October was 32 days, whereas in September it was 63. We do plan to see that, or we anticipate that this number might increase next month in next month's reporting, as we still do only have, 2% vacancy rates for units. And all of that 2% vacancy rate are not going to be units that our clients can rent or qualify for. We are still working with our core services on weekly coordination to increase the work of the housing surge. The coalition is working on a way to connect with our infrastructure partners more on the housing surge, and hopefully next month we can come to you with that plan. Out of our month 4 accomplishments, the one I really want to highlight this month is our engagement with AHD to provide PCA, which is personal care attendant, or PCS, personal care services, to those at the congregate and non-congregate shelter for people who need a higher level of care. This really happened in part with our collaboration with ADRC, where we started to look at a process of identifying those that needed a higher level of care. And once we identified those and started doing the person-centered intake, or you'll hear it called the PCI, we were like, oh, these people are, in congregate and non-congregate settings and still aren't getting their needs met. So apparently now that we have raised that concern, and with a great collaboration, the resource request has been put in, and we are just waiting for that to be finalized. And next month, hoping to report to you all about our clients receiving those services. The bottlenecks and challenges for October, you will see some of the same ones that you've seen last month and in previous months, because they are still bottlenecks and challenges and have not been solved. But we want to continue to keep them here so that you know that we know that that is a concern, and that we are looking at solutions or how to address those in the coming future. One of the new or reoccurring items on this list is the need to reestablish coordination of efforts with Mass Care and AHD on the housing surge. One of the things that has come up is with the change in leadership and loss of staffing, we are not able to have that coordination established as we did in the beginning. And we want to get back to really impact this system and make sure that we are doing the work that our community partners expect us to do, and really engaging that with our clientele. And we can't do that without having Mass Care and the health department at the table with us. So we are making those connections. I will also say that the coalition has been working with Rob Sayi with Mass Care recently, and we're looking for that weekly engagement coming along. And with the loss of Nicole Lebo, I know that our new interim executive director is looking at who our point of contact will be, so we can continue our work. Segueing right into that, the health department was vital in our DHSS component, where we were looking at a macro level of assisting our people experiencing homelessness access to benefits through our public assistance department. So without that connection, again, that work stalls, creating an opportunity of training and education for our case management. All of that was being done and coordinated is stalled at this moment. But again, in my humble opinion, we are hopeful that we will continue this work once we have that point person identified. The other thing that has been put on our radar are hospital discharges to shelter without additional services to meet the client needs. Our emergency shelter systems are not equipped to deal with folks that need a higher level of care. And I know this is a conversation that we're continuing to have, but we have put this on this list now to have the bigger conversation and hopefully get our hospitals involved on discharge planning processes moving forward. The CSS intensive case management team is waiting on the health department for their reporting requirements so that ICA can create the framework for data entry. One of the things that I really, because I'm data oriented, like to see is that in these contracts, it states that they have to put their data into HMIS. If they're not able to access HMIS because of needing reporting requirements, then we are not able to pull the data that is necessary to do this work and necessary to report to you how the money has affected our community. So we really are hoping that next month, CSS, Intensive Case Management, will be able to get their data into HMIS, and we will be able to report on that. And one of the longstanding challenges that everyone knows is the accessibility and availability of affordable rental units. But we have something great coming up. And so the United Way, with their landlord housing partnership, is really ramping this up. And I think you'll be seeing some flyers here later this month. And Nancy Burke and her team are really motivated. And I know a lot of case managers are excited to see this come out. Just going to quickly talk through this, and maybe they can present to you at another time. But this is really going to help our work with our Built to Zero framework at the coalition. So when we're talking about Built for Zero, it's looking at the outflow, people that are experiencing homelessness and moving out into being housed, and inflow, people who are coming back into the system either because they were homeless before or new to homelessness. With this landlord housing partnership, we are hoping that we are going to be able to retain people in their units. They are creating a phone number and an email address so that landlords, doesn't matter the day or night, weekend, holiday, can leave a message and say Jane or John Doe is, experiencing this, and that we can get a case manager out to them to try to mitigate whatever is happening in that unit to keep that person housed. And it could be as simple as Jane or John Doe has not lived by themselves in a long period of time and the house is too quiet and we need to help them purchase them a radio or a TV, or maybe they need something outside of their home to do. So when they come home, they're ready to rest. There are many things that can help individuals. And we know that permanent supportive housing does work, but this is another way to try to meet the needs of those clients while keeping them housed. The other thing you'll see here in the blue is the risk mitigation resources, where landlords, if Jane or John Doe has, put 3 holes in the wall and broken a door, they can go back and ask for, with proof, that amount up to $1,500 to be reimbursed to them. We're hoping this creates a relationship with our landlords, that we value them, and also hoping to decrease landlord burnout to where they are willing to rent to another person experiencing homelessness after that person leaves their unit. And then, of course, like I said, really like databases. They are creating a database that property managers, landlords, case managers, clients can utilize to see in real time what units are available. And yes, we have Craigslist and we have all those other things, but this is a way to engage our private landlords, those that have fourplexes, triplexes, duplexes, that might be wanting to rent to someone experiencing homelessness, but just doesn't know the right avenue or wants a more formalized approach to that situation. So we are excited about the landlord housing partnership, and that should really help with our inflows. And lastly, we want to talk about outreach. In October, there were 96 unduplicated clients contacted and 15 coordinated entry assessments. And it was nice to hear about the camp abatement earlier in this call, but in the month of October, we had some unclear communication around camp abatement in the winter, and unclear communication about timing, about standing up the warming tents and access to additional shelter. At the coalition, I know that our previous executive director always said, winter is always coming. So hoping to bring these to this body so that way next year we're having these conversations about when these things would possibly occur earlier, so we are ready and that we're all on the same page. That concludes my report, and I I'm here for questions and also have the Director of Operations, Taylor Donovan, on the call. Thank you.
Great. Thank you so much for the presentation. Happy to hear about some of the progress on that housing partnership. Are there any questions from members? Otherwise, I do have a couple. Okay, not seeing anyone in the queue. Then who do we have from the health department here who can respond to questions?
Hi, this is Andy Nestor. I'm the Housing and Homeless Services Program Manager. I believe also online is the replacement for Nicole Lebo, which is Dave D'Amato. But I'm not sure if we can answer the questions right now, but we can sure attempt to.
Okay, great. All right, well, I'll go ahead and go to Ms. Kennedy, and then I'll ask my questions after. Go ahead, Ms. Kennedy.
Thank you, Mr. Chair. My question is in regard to the number of single males that were trying to respond to their needs for housing. I noticed that the number was maybe about, I think it was 58 that were actually housed, but also in that large number of 2,000 plus, it was mentioned that not all of them actually needed housing. So, and you might have said it and I missed it, but can you tell me what number for single males that we really are looking at for those that actually do need housing and should or hopefully will be in some way, shape, or form in the case management program? Thanks.
Great question, and I'm sorry I might have fumbled that. But the number, the 2,065 individuals were not males. They're just single adults over the age of 25 that have stated they're experiencing homelessness.
Okay,
So,
okay, sorry.
right.
Then yeah. Okay, then of that number, then how many of those individuals are actually seeking housing of some sort, and we're hoping that they'll be in this in the program for whatever assistance we can render them? Thanks.
So we're not currently collecting the data on just who's seeking housing, but I can tell you that out of that number, 308 unique individuals actually went forward to getting intense case management, being provided employment referrals, medical services. So that's what we're tracking at this point. And I can let Taylor jump in if she has any extra advice to add on that one.
Hi, everyone. This is Taylor Donovan with the Anchorage Coalition to End Homelessness. A little context around that number. So when we talk about Built for Zero, that 2,000 is that population Taria was describing is anyone who interacted with the homeless response system and was experiencing literal homelessness in the month of October. So it may have been they stayed at shelter for one night, or they may have stayed at shelter every night of October. Yesterday. So that's when we're talking about that. And often we give the extra context around it because people will say, well, we don't have all those shelter beds. Where are these folks? But they did experience homelessness at some point in October. Like I said, it could have been a couple nights or many nights, and then they were camping or they were couch surfing, but all experienced homelessness in October. And in general, if you're looking for a single male number, about 2/3 of clients experiencing homelessness are male and single adults, but let me get a more accurate data point for you on that one.
Thank you. And yeah, and I was just really trying to grasp what number of homeless people we really do have, whether they're male or female. That really I wasn't trying to get at one or the other, but just trying to understand more of who's kind of out there wrestling with this issue of homelessness, whether or not we've actually been able to make some kind of contact with them or not. I'm just kind of wondering what kind of number is out there of people that just really aren't coming forward, or we haven't made contact with them, or whatever. And that just may be a number that you just really can't pinpoint, and that's okay. So anyway, but if there is a way of telling kind of how many others are sort of out there on a regular basis, really experiencing homelessness, that are not in the system, so to speak, or are not actually getting some kind of case management help to try to work toward getting them some sort of housing, then I would be interested in knowing what that number is. Thanks.
Great, thank you, Ms. Kennedy. I just want to note for the record that both Ms. Allard and Mr. Weddleton are here. So I do have a couple of questions since no one else is in the queue. Both of these questions are for the health department. So first, I just want to confirm, so Mr. D'Amato, you are taking over the responsibilities of Ms. Levo. Does that mean that you are the new point of contact for the coalition and our community partners in these various efforts?
I don't know if Dave is on this meeting because he said he intended to join it, but I don't know if he has an invitation. So this is Andy Nestor. I have just sent an email to Taria and to Taylor saying that they can send their concerns to Dave and CC me. He's only been on the job for, like 2 days. So he is still getting oriented to the landscape. So you can keep me on the point of contact and also send Dave the stuff, and then we will figure it out.
Great, thank you. And I think I just saw Mr. D'Amato join us. If he wanted to chime in, basically the question was, for Mr. D'Amato, since Ms. Levo is no longer with the municipality, are you the point of contact for the coalition and the various community partners on some of the efforts that were presented today, housing surge, etc.? And perhaps Mr. D'Amato isn't here just yet. All right, so then I'll go to my second question, which is, so for, I don't know, maybe 2-3 months now, we have seen in the bottlenecks and challenges, we have seen the Anchorage Health Department and the state of Alaska in those particular slides. And I know we addressed this a bit at the committee meeting last month in October. So I was just wondering if someone from the health department might be able to address those 2 slides in particular, the bottlenecks and challenges, and how the health department is working on overcoming whatever issues are at hand.
We will continue to work with ACEH for those. I know that some of the things was just the concern of the point of contact. It was Nicole Levo just left us. So again, ACEH can contact myself and Dave to figure out who will be the point of contact for that in the future. But there are people here to answer their questions. If you do have a specific question about the bottlenecks, please tell me. I don't have the slides in front of me. I have attended all of the Committee on Housing and Homelessness for several months. So if you ask a specific question, I may be able to answer.
Okay, great, thanks. I'm wondering actually if Taria, if you might be able to put up those slides, or if Travis, you might be able to.
I can share them real quick.
Thanks. Okay, great. So yeah, thank you. I think folks from the health department addressed that first bullet point. So it sounds like there's going to be a new point of contact, and things will be working out there, which I appreciate. So that second slide did detail, second bullet point there details some issues, particularly with some specialized care that I believe Turia was mentioning that the shelters aren't necessarily equipped to deal with. So, I'm wondering if there's something that how the Anchorage Health Department is focused in or assisting in that area.
I don't see an issue on the slides that is saying anything about the shelters, so I'm having a hard time figuring out what question you're asking. Can you go to the next slide? Is that where it is?
Thanks. So I'm actually, Taria, are you still with us?
Yes, I am here. I didn't know if I
Okay.
could interject or not. Sorry.
Yeah, no, go ahead. It'd be great if you could go ahead and just re-explain that issue.
Okay, wonderful. I think what the coalition is looking for here is more of a collaborative relationship. So not just coming with problems, but being able to sit down with Nicole. We had weekly meetings to address things that were coming up and really looking at a long range goal. We all know that homelessness has been an issue in our community for a very long time. It is not something that's going to go away overnight. And although there are instances where we're doing crisis management inside of our congregate and non-congregate shelters, there really is an opportunity for growth here and to look at a way where we can look at the system overall and try to plan ahead. So if you go back to the slide before, please, I believe Mr. Travis, thank you. Mr. Felix Rivera was correct. The second bullet point was something that we were working with Nicole on and the health department, which is really looking at how can we impact that system with our DHSS partners. And so this kind of defines the broader view of what we were talking about. And you have sent an email outside of this meeting, we can really dig into what it is that we need. But what we need definitely is having a collaborative relationship with you at this time. And other than homeless services and with other homeless service providers. Does that help?
It does. I know that my group has been working with ACEH ever since I've gotten here. Nicole was left on Monday, so this is literally day 2 after she's been gone. And so a new person is in their place. And I know that Dave D'Amato is very willing to work with you to help this growth and make it better. Again, it's his second day. I don't even know if he was on the meeting invite for this, but I know that we are definitely willing to work with it. And I believe you and I just had a meeting 1 or 2 weeks ago to try to start working on some of these issues too. So willing to grow.
We are definitely excited to continue the conversation. We just didn't get the communication on who the point of contact is. And there has been, I believe, 2 meetings we had this week that were canceled because we just didn't know. So again, really looking forward to working with the health department. And we've had great interactions before. And you're correct, we were on that meeting with like 20 different people, but really wanting to dig into the work with you guys. So thanks again. And thank you for this avenue to put those challenges up here so everybody else can see those.
Great. Thank you so much to the health department and to the coalition. It sounds like connections have been made. So hopefully, come next month, we can see some updates on some of these bottlenecks and challenges. Are there any other questions on the coalition's presentation before we move on?
Hi, this is Dave D'Amato.
Oh, hi, Mr. D'Amato. Go ahead.
I just wanted to let you know I just got on the phone call 45 seconds ago and was listening a bit. I don't have Zoom access yet, so I'm not seeing the presentation that you've got, but I'm available to answer any questions if anybody has any.
Great. Thank you, Mr. D'Amato. I'm not seeing any, so we'll go ahead and move on, and then we'll come back to this next month. So thank you so much, Turia. All right, so next we have item 3 on our agenda, data cleanup at mass care, and I believe the health department is reporting on this item. Is someone from the health department able to report on this item?
Who had been communicated that they were supposed to report on this item? Because if it was Nicole, then that information is now, we don't know what has been communicated with.
Thanks. Sure. So similar to Mr. D'Amato, I'm stepping into this role. So the previous chair set up this agenda, and I believe the previous chair talked with Mr. Gervais about this agenda item, and likely about the next agenda item as well.
I think the Anchorage Health Department, due to the changeover, is going to need to report on this later. We'd be happy to get back with you with the information when we can.
Okay, great. We can go ahead and keep this on next month's agenda, assuming we have a committee meeting next month. All right, then we'll go ahead and move on to winter surge capacity. And I think the idea here, just going over some notes that I got from the previous chair, was to do an overview of capacity at non-congregate and Sullivan and what happens when it's full or when the weather is quite cold, 10 degrees or below. So is someone from the health department able to report on that issue?
Again, we'd be happy to get back with you on this. The information I do believe exists, but I don't currently possess it.
Okay, thank you. So we'll go ahead and...
Hi, this is Dave D'Amato again.
Oh, sure, go ahead, Mr. D'Amato.
Sorry, we don't have, or I'm sorry, I don't have a copy of the agenda, which includes the questions that you're trying to ask, nor do I have access to the presentation that that was just put on. Is there a chance that you could forward those to me so that I could maybe formulate some responses and provide them to you in a written format, so that we don't have to wait until the next meeting? If something's pressing, we'd like to be responsive to the request of the committee. However, in the absence of having the information or the questions in front of me, it's impossible to respond.
Sure, absolutely. So both of the documents that you asked for, the coalition's presentation and the agenda, are on the committee's website. But Travis, I'm wondering, can you please email Mr. D'Amato the both of those documents, please? Or a link where to get both of those documents. And I'll go ahead and just, as I understand them, again, this is sort of a transition agenda. The previous chair came up with this agenda. But as I understand, for the data cleanup at mass care, that's an issue that I think has been raised in previous committee meetings. And I think the question on that particular agenda item is related to how the data cleanup might impact or might not impact FEMA reimbursement. I think that is a big issue that we want to keep on top of, how that FEMA might be impacted. And then on item, oh, so I can go ahead and pause if you have something. Okay, and then on item 4 on the agenda, the winter surge capacity, I think the idea here was just to get an overview of capacity at both our non-congregate facilities as well as the Sullivan Arena, and what the current policies are when it's full and or at 10 degrees or below, which we have experienced quite a bit of that recently and will going on into the future. And then, I think there were questions about, particularly last night, the census for the Sullivan was at negative 65 spaces. So it was at overcapacity, whereas the census for non-congregate was at positive 16 units. And so I think we just wanted to dive a little bit into the policy questions there. How are we balancing what units are available? So I'm happy to put any of those questions into writing and send that your way, Mr. D'Amato, so that we can get written responses. And then if there's any follow-up, we can keep these items on our agenda for next month. Okay, so I'll go ahead and just pause before I move on to the last item to see if there are any other comments or questions. And just as an FYI, I'm hearing a little bit of noise and feedback, so please, if you're not speaking, please make sure to mute yourself. Are you not seeing anyone else in the queue? Then we'll go ahead and move on to the last subject. So the warming tent. So I went to go visit the Sullivan last night, at the suggestion of Mr. Gerace, and the warming tent wasn't set up yet. And I'm wondering if there's any update on when that might be set up, if anyone's able to respond.
Hi, Felix.
Hi, go ahead,
I
Mr.
hit
Tomato.
unmute and speak, so I'm not being unresponsive. We've got the warming tent underway. It's been erected. It has the generator and the propane, that is the heat, is going in today. And then from there, the operations will get built out. We're hoping to have it substantially completed structurally and organization-wise by Friday. Operationally, we'll get it on just as quickly as we can. But we're moving at a breakneck pace because we've just started on it a few days ago.
Okay, great, thank you. Go ahead, Ms. Allard, and then I'll put myself back in the queue.
Thank you. I just wanted to say welcome to Dave D'Amato, since he's new at the administration, and I just wanted to acknowledge that we're grateful he's here and appreciate him jumping on the call today. Thank you, Chair.
Thank you, Ms. Allard. Okay, so then seeing no one else, I'll go ahead and continue. So just out of curiosity, what are going to be some of the policy changes, if any, in relation to the census in the Sullivan after the warming tent is up and in place?
Hi, this is Dave again. In terms of the census, it's controlled by two factors, as you know. The actual capacity of the census is controlled by the health conditions and health directives we get related to COVID-19, but also the capacity instructions that we get from the fire department. The emergency cold weather shelter is not a shelter as such, and can't be counted as shelter space. And so the actual attachment of the warming shelter to the Sullivan facility doesn't change the census in and of itself because it's not classified as a shelter as such. Having said that, a rational question that might flow from that is how many people will the warming shelter accommodate? And we're working on tables and chairs and layouts this day, and we'll have a better sense as to what that looks like in the next couple of days, because we're figuring out through the fire marshal and others what the appropriate layout and the rest of that should be. It's helpful to note at this juncture that why we're reinventing the wheel is that the warming tents that were in place last year, there was some substantial snafu that prevented them from being down there. And but for the extraordinary efforts of Joe Garace, we were able to quickly source an Arctic quality tent that had snow load capability, et cetera, that we were able to get set up here in just a matter of a couple of days, that will serve the purposes and is a close facsimile in size. So yeah, any other questions beyond that?
Great, thank you. I did have just a clarifying question. So it sounds like then, so for the last several days, if not weeks, the Sullivan census has been over capacity. So will the warming tent, will that capacity, basically, are you going to be accepting over capacity regardless of the warming tent? Like the warming tent isn't in replacement of those extra beds that are in the Sullivan?
No, that, as a matter of fact, so it's helpful to understand that there is a legal distinction between the role of the warming tent, the function of the warming tent, and the shelter capacity at the Sullivan. For example, the actual purpose of the warming tent is to provide spaces for those who cannot or will not, for whatever reason, enter the Sullivan. And so they are not necessarily people who are even allowed in the Sullivan. Therefore, we make provisions to, so for example, to provide food and drinks outside of the Sullivan so that they have a place that they can go to that they may, that's different from the Sullivan itself. In terms of the capacity, I'd refer you back to that earlier answer, which is that those are controlled by the fire marshal and our COVID restrictions, and we're working on expanding capacity, our understanding of the capacity limitations right now, and we'll have a better answer for that here shortly.
Okay, great. Thank you. That's a very helpful answer. I appreciate that, Mr. D'Amato. All right, I'm just going to go ahead and pause. Is there any other questions before I move on? I did have one more item under this topic. All right, not seeing or hearing anyone. Then I did want to bring up one more item, and it's a bit of an unfortunate item to bring up, but I think it's important just to clarify on the record if there's been any sort of policy change at the Sullivan. But so when I went to go visit the Sullivan yesterday, again at the invitation of Mr. Gerace, he suggested I go take a look at the Sullivan when the warming tent is up on Tuesday. And so I went to go do that, and I saw that the warming tent wasn't fully set up yet. And I appreciate that it's being worked on. When I went to go ask staff at the Sullivan sort of what was going on and if they had any updates, it was suggested to me, and I guess I'm saying that word politely, that I needed permission to be on premises. So I just wanted to clarify with the health department if there's been any type of policy change regarding that, because I did ask the previous chair and others about this issue, and that's just not something that's been required in the past to have some type of permission. So can someone please clarify that? Because I was frankly taken aback yesterday by that.
This is Dave D'Amato again. I don't know what the previous policy was regarding access, whether or not it was on demand. Was that your experience prior to yesterday's visit?
So I myself went to go visit the Sullivan on Sunday, actually, with the vice chair constant of this committee. And we did give a heads up to the health department, but we did not request permission to go and go to the Sullivan. So, I just wanted to clarify, if there's any processes here that we need to make sure that we're crossing our T's, dotting our I's, because both Sunday's visit and the visit yesterday, just to get a sense of what's going on, certainly not to get in the middle of operation. So there's any clarification that you can provide to myself or the members, because I know, from time to time, some of the members do like going to the Sullivan and just getting a look at what's going on. So if there's any clarification you can provide, that would be helpful. The last thing I want is for a member who, wants to go to get any roadblocks like I had yesterday.
So I think I have not seen a formal policy that's been written out. We know that there is a process and there are limitations regarding access to the Sullivan for various people and groups. For example, we're not letting the public at large wander around and take photos, that sort of thing. And then there's a different approach for the media. But what I'm hearing you say, Felix, is that we need to have a policy that's comprehensible and predictable for members so that they understand how they are able to access the Sullivan. And I'll put that on my action items list. I will get something here. And I think Kelly Isham just said that he could speak to this as well. But I think formalizing something would be great for everybody so that we all know exactly what the rules are that we're abiding by.
Great, thank you. I look forward to that. Ms. Allard?
Kelly, did you have something that you wanted to add?
Yeah, I have actually a comment and directly
actually,
what you're concerned about too, Felix.
Sorry, Ms. Allard. It looks like Mr. D'Amato had someone else who he wanted to speak. And then I'll get to you, Ms. Allard.
Okay, thank you.
So Mr. D'Amato, did one of your staff want to add something?
Chair, can you hear me?
Yes, I can.
Hi, this is Kelly Isham, also with the Health Department. David D'Amato is my immediate supervisor, but I also serve as the Operations Section Chief for our COVID-19 response. And just pointing out, do apologize that essentially you were turned away on your visit yesterday. Our goal is certainly not to turn anyone away. We are also just trying to remain respectful of those clients that are in the Sullivan, as well as our contractors that are serving the population in there. As you pointed out, we are over capacity for the shelter as a whole. And so we are just trying to limit the foot traffic through there. However, if it is, requested in advance, we can make sure, essentially just to provide, a tour or an ability to go in there and see what's going on with proper precautions in place. So I think that was speaking to staff this morning, that was what we had forwarded on to them. But certainly moving forward, as Mr. D'Amato just said, we'll certainly look at putting a written policy in place just so it's clear what we're doing. But, again, that yesterday was just to ensure the safety and security of everyone inside that shelter.
Great, thank you. Ms. Allard?
Thank you. And yeah, I just wanted to speak to that because before, I think it was like in May, maybe it was April, I had been told when I wanted to go down to the Sullivan Arena that I needed to make arrangements with the prior administration just for safety reasons, because if we were in a pandemic, for COVID, for safety reasons with individuals that I might not know, or for capacity. So I had been told before that we needed to kind of give a heads up to the administration. So for me, this wasn't anything new or alarming that we would continue to do that. But that's my personal experience with wanting to go down there. I visited down there, but I went with a group of individuals that escorted me and showed me around. So that's my experience. And I do appreciate the administration just kind of fine tuning it with some sort of memorandum for record. Thank you, Felix.
Thank you, Ms. Alec. All right, I'll go ahead and pause, see if anyone else wants to get in the queue before we move on. All right, not seeing anyone else, then we'll go ahead and move on to next item on our agenda, which is number 5, committee legislative and budget priorities. So does anyone have any legislative priorities or 2022 budget items to bring up?
Felix, can you repeat that question, please?
Sure. Yeah, I'm just on the next item in our agenda, the committee legislative and budget priorities. So I'm just opening the floor if any members have either any legislative priorities or 2022 budget items regarding homelessness or housing to bring up. All right, not hearing any. Then we'll go ahead and move on to final audience participation. So would any members of the public like to participate? You can unmute yourself. If you're on the phone, I believe it's *6 to unmute yourself. You can go ahead and give us your name for the record. You will have 3 minutes.
Roger Branson.
Yes, go ahead, Mr. Branson. You have 3 minutes.
Thank you. Roger Branson, a resident of Eagle River and advocate for homelessness, mental health, and a lot of folks who are caught up there at the Sullivan Arena. The warming tent will hopefully allow us to have some activities, some kind of community building stuff there. I'm really frustrated that this came online without any, real collaboration with the people that will be using it. But the other thing that was kind of alarming that folks saying there was talking with somebody representing the city. There was an issue of wanting to get vehicles out of there, and the possibility of having folks' vehicles that are not being moved regularly impounded came up, and it's very concerning for me. For a specific part of the population who may rely on the vehicle to stay safe coming in there, and then when they leave, we'll need that vehicle to get them to whatever's next. That aside, I'd like to talk or comment that the HRAC is having their third Thursday. That's the members meeting today at 3 o'clock in the hub area. And I'd like to also say that I very much appreciated hearing both of the Eagle River Assembly members on the call today. If either one of them would like a back tour of what's going on outside the arena, the parking lot is a public area. There's no process for the media to go in and out of there. They do coordinate with the management of the facility when people come on the floor, mostly because they just don't want the folks' privacy being intruded. And that's the other issue with folks having vehicles in the parking lot, is that they have a place where they can have a little bit of privacy. So anyway, very concerning times, very concerned about the turnover of folks. And last night, I really had to struggle hard to not go start driving the streets looking for people who were not in shelter. And thank you for all you guys do. I'm done.
Thank you, Mr. Branson. Would anyone else like to participate? Again, it's *6 to unmute yourself if you're on the phone. If you could introduce yourself for the record, then you'll have 3 minutes. Okay, not seeing any other members of the public who wish to participate, we'll go ahead and move on to committee discussion, and I believe Ms. Kennedy has something she would like to add.
Thank you, Mr. Chair. I just wanted to mention that at our last month's Housing and Homelessness Committee, I'd asked the question in regard to how many arrests had been made at the Sullivan Arena. And Chief McCoy did get back to us with that information. And all of that has been sent out to the assembly members, so I'm assuming that it's also public information, and I didn't know if you wanted that posted on this website for the Housing and Homelessness Committee's webpage or not. So I'm just wanted to mention that Chief McCoy did get back to us with that number. There was 254 arrests made since the Sullivan has been set up as a mass care shelter. So anyway, just wanted to make people aware of the fact that that we do have that data. Thank you, Mr. Chair.
Thank you, Ms. Kennedy. And yes, I do believe that that information is public. So if you can go ahead and, Ms. Kennedy, if you could forward that on to Travis, we can go ahead and have Travis put that on the committee website.
Absolutely. Thank you.
Thank you. Is there any other committee discussion? All right, not seeing any, then I will go ahead and thank everyone for your presentation and discussions today. I am not sure yet if we are going to have a committee meeting in December. I think typically we take December off for this committee, but I do know that there are some agenda items today that we couldn't get to in full. So we may or may not have a committee meeting. It'll probably be earlier in the month, though. Just take a look at your calendar for an invite in the coming weeks. With that, I'll go ahead and adjourn this meeting and wish everyone a good day. Thanks, everyone.